Ladies and gentlemen, thank you for coming. It's my pleasure. And I see so many smart faces here, so I'm a little bit excited about that, because it's always nice to talk to the people who know what I'm talking about, or who enjoy it and who responds. It's very important. And the reason for that is because I think that people who come to this lecture or to this expo is kind of lucky, and they're very smart because they realize that they need to do more about their health. And that's why they're lucky, because they, as soon as they realize, they can do something about it. But people who don't, they're kind of stuck with the old way of thinking, and just they don't do anything. And that's why I think it's very important that you came here. And what I'm going to do is to talk about bioidentical hormones today. And this is going to be the story about the actually new treatments, and how it can change your life to the better, give you health, give you more health, and make your life more productive, get you more energy, get you more fun in your life, more energy, more sex drive. And it's also a story about how a new way of medical thinking can actually change your life to the better. And the reason why I'm going to talk about that, because bioidentical hormones changed my own life. And that's how it happened. It happened about 10 years ago, and I was a medical attending in a city hospital. I was working like crazy. I was doing full-time in the hospital, and I was doing my own private practice at the same time. And I felt fine. I felt perfect. I felt energetic. I could manage 2 jobs at the same time, and I was fine. I enjoyed what I was doing, and I thought that I was doing the right thing. Until one day, I wake up in the morning, I still remember it was Sunday, with the terrible feeling in my chest. It was kind of somebody was sitting on my chest like that. And I just checked my pulse, and my pulse was racing, it was irregular, and I immediately realized that I have irregular heartbeats. I was 45 at the time, something like that. In the beginning, I was not scared at all, because I knew exactly how to manage this condition, because I managed that for my patients many, many, many times. You can't even imagine how many. So I knew exactly I need to do 1, 2, 3. I need to check the heart. I need to check my heart. I need to check my cholesterol to make sure that my arteries are not clogged, to make sure that I don't have any valve problems, etc., etc. And I was not scared at all, because I knew the guidelines. And I started doing according to the guidelines. I checked my, first what I did, I checked my arteries to make sure that it was not clogged. I went to the stress test, and I was running the stress test, and I was running, and guess what happened? My stress test came back perfectly normal. I didn't have any clogged arteries. So I thought maybe I had some kind of valve problems that created the instability of my heart, and that's why I had irregular heartbeats. I went to cardiology, and they did the echocardiogram, and I still remember the technician. Her name was Marie. She was looking at my heart at the screen. She looked at the screen and said, "Doc, you have a gorgeous heart." Usually patients, if they are told that they have gorgeous heart, they should be very, very, very happy. But I was not, because if I have perfect heart and gorgeous heart, why would I have irregular heartbeats? So I thought that maybe I had high blood pressure, that's why I had irregular heartbeats. I started checking my blood pressure like crazy. Every 5 minutes, blood pressure check. 5 minutes, blood pressure check. 5 minutes, blood pressure check. Guess what? My blood pressure was normal. I checked my cholesterol. It was a little bit elevated, but not that much to explain irregular heartbeats. So I was puzzled. If it's not clogged arteries, if it's not heart, the structural problem, if it's not high blood pressure, what is it? What am I supposed to do? And I went to cardiology. to cardiologist who was we were working together, and asked what do I need to do? And he said, you know very well, you need to take blood thinners for the rest of your life to stay alive. Yeah, you know, who has irregular heartbeats, they have a very high probability to have stroke and heart attack, etc. So they need to take blood thinners, Coumadin. I was shocked. First time in my life, I was told that I need to take a drug that actually would control my life, because I knew exactly how many side effects Coumadin has. It's bleeding in the gastrointestinal tract, it's bleeding in the brain. Who is on Coumadin, he falls down, hits his head, and that's it, done. Hemorrhage in the brain. And I was horrified because I didn't want a drug to control my life. Can you imagine that? Drug controlling my life? I didn't want that. But I didn't want to die either. So first time in my life, I realized that taking care of the just symptom, irregular heartbeats, taking blood thinner, is probably not that great idea as I thought before. And to be honest with you, I prescribed blood thinners many, many times, but I didn't want the same thing for me. And I asked cardiologist, what's going on? Why do I have heartbeats? How can I avoid the blood thinners? And he said, you know, we know that you have irregular heartbeats, but why? We don't know. That's why the only solution I can offer you is to take blood thinners to stay alive. I just want to put that behind me, to be honest with you. That's not the best part of my life. So I'm trying to forget that, but still I'm talking about because it's very important. So first time in my life I realized that taking care of the symptom per se is probably not a good idea. I needed to find the root cause of the problem. Why I had my irregular heartbeats, to eliminate the root cause, and that's why if I remove the root cause, I wouldn't have irregular heartbeats and I wouldn't need to take blood thinners, right? So I tried to figure why I have this in the first place. And I couldn't find any reasons. Couldn't, and I was horrified. I was not taking blood thinners because I didn't want a drug to control my life, but I couldn't find the root cause of my problem either. Actually, I didn't know what would happen next day. So at that time, you know, I was thinking about what was the most important to me, and at that time I was my daughter, and I called her and said, you know what, I have irregular heartbeats, and I don't know what will happen tomorrow. And I don't know what to do. And my daughter said, Dad, what are you talking about? You're a doctor. You're supposed to know what to do. But I didn't. You know, not always, you know, everything is that simple. And I didn't know what to do, how to manage my condition, and I started looking for the root cause. I started looking at that. I was sipping through the literature, and I was desperate. I almost lost my hope. And then, the first glimmer of hope. A friend of mine who was anti-aging medicine, he told me that, you know what, maybe you have hormonal imbalance. Maybe you need to take bioidentical hormones, and that's the reason of your irregular heartbeats. I didn't have anything to lose when I'm supposed to lose nothing. So I checked my hormones, and guess what? They were out of whack. So I was trying to now focus on my hormones, how to fix it. And he told me, why don't you take bioidentical hormones, and then that will help you. Once again, I didn't have anything to lose, so I started taking bioidentical hormones, and I corrected my hormonal imbalance, and, you know, there are no miracles. It was not like, you know, I became healthy next day. No, it doesn't happen in real life. But little by little, step by step, day by day, I started getting better. And I got rid of regular heartbeats. I felt like, like a normal person. Because, when you have the paroxysm of the irregular heartbeats, you never know what will happen to the next minute. I can talk to you if I had it. I would talk to you, and next time I have a regular heartbeats, I have to stop lecture and sit and collapse or whatever. That's not the best life you want to have. That's not what you do. That's not what you want to have. So I got rid of that. And the first time I realized how important it is to look for the root cause and eliminate the root cause instead of just treating the symptoms. And I thought that if bioidentical hormones are good for me, maybe they are good for my patients. I remember a patient, my patient, she came to me in the evening. I was working in the hospital in the morning and my private practice after 5 o'clock, so it was like 7, 8 o'clock, and she came and she was sitting in front of me, and she didn't say a word, but I just noticed tears coming. Yeah. And I thought that maybe somebody died in her family or something. It was not that, that was her, she was very upset because of her manager, because he threatened to fire her because of her mood swings. She was a secretary, and she was dealing with the customers, and because of her mood swings, she couldn't control herself, and that's why customers were complaining, and the manager said, either you don't do it again, or you're out. It was actually her boyfriend who threatened to leave her because she was always wet. She had hot flashes, she had mood swings, she couldn't sleep. And he said, you know what? I don't want somebody wet around me, next to me lying in the bed. Always she had problems with her son because she was shouting at her son without any reason. So her son said, you know what? I don't want to live with you anymore. And so she was very upset. She was going from doctor to doctor. She went to her primary care physician, and primary care physician said, you need to take a sleeping pill, you need to take psychiatry, you need to take some sedative, tranquilizer, and that's it. But she didn't want a drug to control her life, like me. So she eventually came to see me, and when I just started talking to her, examining her, I thought that maybe really she needs to have to see psychiatry and to have some sleeping pills. And while talking to her, I just realized it came through my mind that hot flashes, mood swings, hot flashes, mood swings, no sex drive, vaginal dryness, sex drive low, hot flashes, night sweats. Maybe she's having just menopause. Maybe it's just hormonal imbalance. It may be as simple as that. And I told her that, why don't we check your hormones? And we checked her hormones. Of course, she was postmenopausal. Her hormones were down. And I said that, you know what? Maybe you should try bioidentical hormones. And she said, what? I don't want that. I said, why? And she said, because I don't want, she said, because I don't want any synthetic drugs in my life that control my, sex drive, that controls my sleep, I said, no, it's not a drug. It's a bioidentical hormones. She said, what is bioidentical hormones? And I said, the bioidentical hormones are hormones that are chemically identical to our own hormones. And it's very important because, why? Because as soon as they are chemically identical to our own hormones, our body knows what to do with them. They know how to dispose of them properly. And she said, really? And I said, yeah, why don't you try? And she said, it's kind of very attractive, and why don't you try it? Because I don't want really a drug, I want something natural. And I said, that's what you have in your body. And I prescribed her a cream. We usually give it with the cream. And she started using, and once again, there are no miracles. No miracles now, but little by little, step by step, day by day, she started getting better. First, hot flashes were gone. Then, her mood swings came down. Then, her sleep started getting better, day by day, month by month. You know, it needs time, because why it takes so much time? Because you need to saturate your body with the hormones. Their sex hormones are fat soluble, so it go to the fat tissue and accumulate them. And in order to achieve the stable level, you need some time to get enough hormones in your body. That's how it starts working. So that was it, and she was happy. And actually, unfortunately, her boyfriend left her, but she got a new boyfriend. She was very happy. She had stable position at her job, and her son developed better relationship with her. So she was quite happy about that, and she continued to take bioidentical hormones, and everybody was happy except me. And the reason for that was because I didn't understand why bioidentical hormones are not widely accepted in the mainstream medicine. I couldn't figure it out. And the reason for that is because if they're so good, so why don't they give it to anybody? You know, I thought that maybe it's the price. Maybe I thought that it's very expensive. So I called the compounding pharmacy who was managing my prescriptions and asked how much is the monthly supply for bioidentical hormones. And the pharmacist said, you know, it depends on how many hormones, what kind of hormones, the dosages. I said, but on average. And he said, about $70 a month. And I said, what about synthetic? I said, oh, much higher cost. So it was not the cost. So I thought maybe it's because of the safety reasons. Maybe the chemicals, the synthetic hormones are safer than bioidentical hormones. So I started sipping through the literature, and I couldn't find any evidence that synthetic hormones are safer. Actually, the evidence is totally opposite. The studies from France, especially, they say that bioidentical hormones are safer than synthetic hormones. Because of the very simple reason, because it's chemically identical, our body knows what to do with that. It's like, you know, the right key for the door. If you put the wrong key in the keyhole, you're not going to open the door, right? That's the same thing as here. Or when you go to ATM machine and get some cash, you know, you put the wrong code, you won't get cash, right? So you need the right code. That's the same thing as here. And I was just really puzzled what happened. And I was thinking that maybe that's they don't need, or maybe it's not really prolongs life, or maybe it's kind of some other problems with bioidentical hormones. And then I started thinking in a little bit different way. Let's put it like that. Instead of asking what are the risks and risks of the taking hormones in postmenopausal women, let's rephrase the question and ask the different question. What is the risk of not taking hormones? And believe me or not, I learned about that in a very interesting way. I was at the time a medical attendant in the city hospital, and I was doing the clearance for the surgery. You know, clearance before somebody goes to surgery, they need a medical clearance. So the medical doctor needs to see a patient and say, hey, this guy is stable, he can go to the operating table, and the risk is low, medium, or high. And because I was doing that, I saw a lot of women with hip fractures who were going to surgery. Yeah, and believe me or not, but hip fractures is a very, very, very dangerous condition because of a very simple reason. Because they can develop hematomas, they are immobilized, they can develop the blood clots, bad sores, infection, so many complications you can't even imagine. But the next thing I thought about that, why do they have hip fracture in the first place? And the answer is clear, because of weak bones. Next question is, why do women have weak bones? This condition is called osteoporosis. And the answer is again very clear. Because they are postmenopausal, because they don't have estrogen, that's why. So I thought that maybe if they were given estrogen, maybe they wouldn't have hip fractures. And they wouldn't die because of the blood clots or infection of bed sores, but actually nobody is putting it together. If somebody is a woman dies because of the hip fracture or bed sores or infection, they never connect that two things together. They never connect that because they were not given estrogen. The woman developed a hip fracture, and that's why she died. But believe me or not, this kind of stuff everybody knows in emergency room. Let me give you a very simple example. Supposedly a woman comes to emergency room with chest pain, and cardiology is called. Do you know what is the first question he asks? He asks, do you have your periods? Why? Because if a woman has periods, so her hormones are up, most likely, and she has a very low probability of life-threatening heart disease. But if a woman doesn't have periods, then her hormones are all the way down, and she has a high probability of a life-threatening heart disease, and that's why they need to launch the full workup. It's as simple as that. So basically, they are using it in everyday life, and the medical decision is based on the hormones, actually. But the next question is, if this is very important, so maybe it would rational to conclude that if a woman was given her hormones, maybe she wouldn't have dangerous heart disease. Does it make sense to you? So it what made sense to me, so I was thinking that maybe hormones are actually the problem when they start having high blood pressure, heart disease, cancer. Nobody has cancer when they are 18, right? I mean, nowadays, you know, I saw the cancers at age 25, but it's very rare. You know, when I was in medical school, I haven't seen anything like that. But nowadays, it's kind of different. So my point is that if somebody starts to lose hormones, actually what happens is that it's kind of signal that the hormones are giving our bodies that it's time to die, because, you know, Mother Nature designed us to make offspring, to make babies, right? And because they want to make babies as much as possible. So who can't make any babies anymore, you know, that's it. And Mother Nature thinks that it's time to go, you know, and that's actually the signal. So basically what we can do about that, we can trick Mother Nature a little bit. Take hormones and pretend that we are still fertile. That's the whole idea about that. So basically, I started using that, and my patients were doing very well not everybody. Listen, don't think that it's a miracle drug. No. There is no miracles, and there are some side effects, and because of the very simple reason, even if they are bioidentical hormones, and they are chemically identical to our own, if you have problems with metabolism, then there is a problem, no matter what hormone you take. And that's what we do. We actually we have a test to check what your body is doing with estrogen, because we check metabolism and see what the body is doing. And if somebody has a problem with that, then we can fix it, because we know there is a problem. As soon as we know there is a problem, we can correct metabolism, the way our body metabolizes hormones. And not everything is perfect, and of course I can't fix everybody. There is no way. But most of the time, we manage to fix it and make sure that hormones are processed in a normal way, and it's reasonably safe. So that's what's very important, because, you know, safety is extremely important, and because people come and think that bioidentical hormones, if you're taking bioidentical hormones, there is no problem whatsoever. No. Every drug or every chemical or any natural substance, if it is used incorrectly, or if there is a problem with that, you know, can create a big problem. Let me give you an example. Natural hormone melatonin. Anybody heard about melatonin? Yeah, you know that, right? Do you think it's safe?
I thought so.
Was that?
I thought so.
Okay. Let me give you, let me tell you about this story, what happened in my clinical practice. A woman came to see me because of insomnia. She couldn't sleep. She couldn't sleep for about 6 months. And she went to multiple doctors, and they couldn't figure it out what it was. And she came to me because she thought that she had hormonal imbalance. So we checked her hormones. She was postmenopausal, fixed her hormones. Didn't work. So we thought that maybe it was some kind of heavy metal toxicity. We checked her for mercury. We chelated her. Didn't work either. She still couldn't sleep. To make the story short, the last step, the next step we did, we checked her neurotransmitter levels, like serotonin, glycine, norepinephrine, epinephrine, etc. When the lab result came back, I could not believe what I saw. And the reason for that is because I was taught that in order to sleep, somebody needs melatonin. And that's true. We need melatonin to sleep. And I expected her to have very low level of melatonin to explain the fact that she couldn't sleep. But the test result showed that her melatonin level was sky high. It immediately was clear to me that she was not able to sleep because of sky high, because of she had too high level of melatonin. I don't know why people believe that the more melatonin they take, the more likely they will fall asleep. It's not true. Melatonin works in like a bell-shaped curve. So what happens is that it works as soon as the level of melatonin is therapeutic, is correct. But if the level goes too high, the effect is totally opposite from the desired. As soon as somebody has an overdose of melatonin, they couldn't sleep. And I couldn't figure it out why she has so high levels of melatonin. I thought that maybe she had the pituitary tumor, which produces high melatonin level. We did MRI. Guess what? Nothing. I was puzzled. So I asked her to come back, and I started carefully again to ask her what she's taking. And to make the story short, she was taking huge dose of melatonin without telling anybody, and she was overdosing herself for months. The only thing she needed to do is to stop taking melatonin, and she started sleeping. That's as simple as that. All right, so basically what I'm driving at, that not everything natural is 100% safe. Cocaine is natural, right? But I'm not advising you to take it. I'm not selling it. I'm not even planning to start recommending you to selling cocaine, even if it's totally natural. Snake's venom is 100% natural, but not anybody in this room is going to take it, right? So basically, not everything natural is good for us. And that's why, in order to get it right, what basically you need to do is to know exactly what you're doing. And by the way, I'm talking about multivitamins as well, because people believe that they take multivitamins is good for them. Not all the time. Because if somebody takes a vitamin or any other thing, or organic food or anything like that, people usually assume that if they put it inside, it does go into their system. Yes, but on one condition, that your digestive system is working properly. What if it's not? What if it's not? So basically what you need to, it goes through, right? So basically it doesn't matter what you take unless your digestive system is working properly. And I learned about that in a very curious way. When I was a very funny way. So what happened was I was getting internship in a residentship in a city hospital, and I had a mentor, my director of medicine. He was one of the best doctors I have ever met. Very smart, very caring. He liked to teach us young doctors, and he, put his soul in it. He cared for everything. And he was always telling us that we need to, we are not supposed to drink, we are not supposed to smoke, we are not supposed to, we are supposed to exercise. We were exercising, like residents, they're running around the hospital, plenty of exercise. And we need to take one pill of multivitamin every day to replenish our system, so to make sure that everything is okay. And I still remember he was recommending us to take Centrum. Anybody know Centrum? Yeah, sure. And I was doing the same thing. I was taking one pill of Centrum every day, thinking that I'm protected. I'm taking everything. I don't smoke, I don't drink, I exercise while running through the floors, and I'm taking Centrum. Because that's what my director of medicine told us. He was always telling, just follow the guidelines, follow the healthy lifestyle, do you take multivitamins? Until one day, I came to the hospital and I saw the picture of my director of medicine on the wall. I'm nearsighted, so I came closer and I realized that basically that was an invitation for his funeral. The guy died at the age of 61 because of melanoma. Professor of medicine, I'm not going to tell you his name, but he's quite famous. I lost a mentor. I lost a wonderful doctor. I lost I can't say he was a friend of mine, but at least, I still feel like he is behind me. Somebody who protects, somebody who advises, and I lost him. But the second thought, I was thinking that he was taking Centrum. It didn't work for him. He died, so I'm not protected either. So first time in my life, I started thinking that maybe it's something else besides the guidelines. And then came the irregular heartbeats, as I told you, and then I found out that basically treating the symptoms is probably not a good idea. You need to look at the root cause and fix the root cause. To make it simple, when people lived in caves, they were very afraid of thunder, of lightning and thunder, because they didn't know the root cause of it. But as soon as they learned that the thunder and lightning is caused by electricity, the root cause of is electricity, the electric current, that's how they learned how to avoid that, and they are not afraid of thunder and lightning anymore as soon as they learn the root cause. But the same thing is here. If patient comes and somebody is sick and has a medical problem and he doesn't know a root cause, he is just a slave of the guidelines because he doesn't have any choice. He needs to follow the guidelines. If he doesn't, he is dead. So that's basically what they want to do, who created the guidelines. They want people to behave as their slaves. But if you know what the root cause is, you are the boss of your own health. You can fix it and get better and get much more energy, much more fun, much more sex drive in this life because you are the boss. That's what it was all about. Any questions?
The
Yes.
side effects of the bioidentical, what are you referring to?
What I'm referring to. First thing is that, it's not one hormone. And in order to do something, you need to fix several hormones. And in fact, sometimes it's quite complicated because you need to know what hormones are affected. It may not be also sex hormones. It could be thyroid, could be adrenal, etc., etc. That's what it is, maybe the problem. So the balance it takes a while to figure out what the balance is, to figure out the right dose. So what might it really in real life happens that by looking at the patient when doing blood work, there is no way you can figure it just from the first visit. So it's trial and error. And the side effects could be, sometimes hot flashes are not fixed. Somebody has some spotting, that can be side effects. That's one thing. That's pretty easy to solve. And the another problem side effects could be that we are not able to raise hormones very fast, and it takes different formulations. We start from the cream, and somebody requires a patch. It's kind of trial and error. So we work on that, and of course, not everybody feels good after the first visit. It takes a while. The other side effects, the most important side effect is if the body is not processing the hormones in a proper way. That's most scary, and what happens is that as soon as it happens, then the metabolites of the estrogen can be cancerogenic. So that's the problem. Okay, so that's what we need to do. We look for the side. We look for the almost done. We look for the metabolites, and if there is a problem, then we just check why it happens, what part of the metabolism is affected, and fix that.
How would you know that there's a problem with the metabolism?
There is a test which we use to check estrogen. Unfortunately, we can check only for estrogen, and it gives us metabolites, and that's basically how we do that. The ratio between several metabolites is called 2:16 ratio, and that's how we do that.
Check how much estrogen is being...
No, it's metabolites. It's, there are two. In the New York State, unfortunately, we are kind of limited, and we check the 2-OH and we check 16-OH, and they calculate so-called 2:16 ratio, and then based on the ratio is low is a problem. If the ratio is high, then it more points towards the osteoporosis.
Are there certain hormones that you find that are out of balance more than others? When you do your tests, you said that when you give the treatment, the screen, is it specifically for estrogen, or is it for estrogen and other different types of hormone?
Very interesting question. And the reason for that is because basically some kind of people usually believe that the tests are everything. And basically, I don't feel like that, because I think that what is important is not the test itself, how we interpret that. And that's why, before ordering a test, I do the history of physical, and I'm an old-fashioned guy. I don't go by numbers. I don't treat numbers. And you can't even imagine how many times people come, and they have perfect numbers, and they still feel lousy. That's very common situation. So basically, answering your question, I go on clinical grounds. Clinical grounds, what I see, what I feel, I go by touch. I feel the skin of the patient. I feel the texture of the skin. I listen to the chest. I look at the tongue. Check the pulse. That's how I go through the history, and then I create my clinical impression and a clinical hypothesis, the preliminary diagnosis. And based on that, I order tests. I don't order everything in the world. It's just not possible. Okay, and then I see if I'm right or not. I either rule it in, what I think, or rule it out. So if I'm not right, I look for something else. It's a trial and error. So the most important thing is, of course, adrenals. They are the king. You need to fix adrenals. Every endocrinologist knows that. In order to fix the rest, you need to fix adrenals first. But that's the most challenging thing in my practice. All right? Yes.
So, I don't know if you discussed it earlier. Did you talk about bioidentical hormones for men?
For men, basically the same thing as for women, and we use bioidentical testosterone. Once again, it's a lot of side effects. So it's based on the particular patient. We just, on one thing is risks, on one benefits and alternatives, and then we decide what needs to be done. Ladies and gentlemen, unfortunately, time is out, so thank you very much for coming.